And welcome to the Oakland County Megacast. I'm Tyler Keefe in the studios of our flagship stations 89.3 Lakes FM and Civic Center TV. Also joining us today, as always, Birmingham Area Municipal Access, which is much like Civic Center TV, on Comcast Channel 15 and AT&T Channel 99. We're also joined by 88.1 WBFH, the Biff, a service of the Bloomfield Hills School District. And we are online today on Facebook via Facebook Live with our friends over at the Orchard Mall. And thank Kelly Woodley and her entire team over there for joining us on today's edition of the Oakland County Megacast. And as always, joining me from her home studio in Keego Harbor is Ronnie Dahl.
Hey, Tyler, good to be here. We made it to Friday, and what a snowstorm that we got last night.
Yeah, it's really something out there. It's already, I would say, probably double what we got last week when we got some snow, or last weekend. It's definitely more of what we were expecting to have gotten last time. We definitely got it this time, as evident by the amount of snow on the ground and the behaviors of people on the road.
Well, it looks pretty, but you know what? Even with the snow on the ground, it's not stopping people from getting out and getting their vaccination. As of January 24th, the Oakland County Health Department has administered 19,424 vaccinations, but of course that's as of January 24th. More are going into the arms of individuals today, and with that, we're going to switch up the show just a little bit and bring in our good friend Chief Greg Flynn over at the West Bloomfield Fire Department, because you guys are doing a drive-through vaccination service there at the Fire Station 1, right, Chief?
Good morning, Ronnie and Tyler. We're with our partners at Oakland County Health. Their staff is running the clinic here today over at Fire Station 1. And I want to start off by saying these are all scheduled appointments today. Everything that the folks are behind me, as you see cars go by, all of them have a scheduled appointment. Nobody is just showing up at Fire Station 1 today.
Yeah, because that is important for people to understand that there is a process to be able to get this. How exactly is this working? Because they pull up, they wait in line. Do they have scheduled times to be able to come there?
Right. So if anybody goes down Orchard Lake Road by in front of the high school here where Fire Station 1 is, you're going to see two of our West Bloomfield police officers out in the turn lane, just kind of slowing everybody down in the area. Folks with an appointment will come in the north apron, the north entrance to the fire station. You'll see a couple bays behind me, the apparatus bays that are open. There's 2 lanes of vaccinations going on. There's going to be over 500 vaccines going into arms here in West Bloomfield today. We're very excited to be part of that and the great success that Oakland County Health and their staff are having with getting these vaccines into arms very quickly.
Yeah, Oakland County has been pretty creative in trying to make it accessible to as many people as possible. And these drive-through vaccination clinics, such as what's happening there, is just one of the ways that they're doing. Chief, what is the process once they get the shot? Because I know people have to be monitored for a certain amount of time to make sure that they don't have any reaction.
Sure, that's a great question. So as they come in on that north apron, they're greeted by someone that's just going to put them in one of the 2 lines. After that, they're greeted by another staff member that checks them in and ensures that they have an appointment. Those that think they're going to be able to sneak in, there's an out spot there where send them on the. Once they check in there, they move up to the next spot where they scan their QR code, and that all gets inputted. They check all the patient, all the participants' information, and then they finally move up to the last spot, which is where you can see these cars coming out right now. They just received their vaccine from the nurse. They're going to continue across the south apron into the south lot by the tennis courts in front of the high school. And there, they'll be under observation of a registered nurse, and they'll wait their 15 minutes. And then they're out, and they're right turn only onto Orchard Lake Road, and they're on their way.
I will say the good thing about this is they don't have to leave their cars, because even if you were getting the shot on a day like today, you have to get out, go into the hospital. So this is a good way to do it in this terrible weather.
It is, and we think it's really safe. It's safe for our seniors too, so we're not getting them out onto slippery surfaces and all that kind of stuff. I want to thank our Parks Department, our Water and Sewer Department. They came through real strong this morning to help us salt and put down a lot of salt and some pre-treatment from our Parks Department yesterday with a brine solution to really make this safe for everybody that's coming and for the Oakland County staff that's here.
Yeah, because on top of that, we have to remember this is your crew is out there and you guys are out in the elements. Now, are firefighters and paramedics actually administering the shot, or are there people from the health department doing that?
It's all staff from the health department. It's a great group of individuals. Again, I just heard some nice music playing in the background, get a very positive attitude here. Ronnie, I hear so much of the negative news about I've been waiting so long for my vaccine and I can't get a vaccine and I can't do this. And I try to reframe this for folks. As soon as they get vaccine, they're calling up folks like me saying, can we get a clinic open and can we do it in just a few days? So they're doing it as fast as they possibly can get that vaccine out. People have to understand it's not the county, it's not the staff worker here that's slowing any process down. Every one of these folks is working to get you through this vaccine line and back to work or back to wherever you need to be just as quickly as they can.
So, Chief, which vaccine is being administered there?
Today, I believe, is a Moderna
So
day.
with that, I know that one of the issues has to do with storage. Is Moderna, though, you don't have to have it the super code storage, correct?
Yeah, and I don't want to comment too much on those because I don't want to misspeak on any of that. What I do know is that the system that is set up here where the folks that are drawing up the vaccine are actually in a different spot. So they have that very controlled. And then they have a runner that is bringing that vaccine out just in time as these cars are rolling up. So I don't want to give you the impression that there's all these vaccines that are drawn up and sitting out here. It's not the case. The county staff that's here, they have this down to a science. And again, by the time you pull into the time you're in this parking lot, I got to imagine it can't be much more than 4 to 6 minutes.
Wow, that has to be great. What's been the reaction from some of the people? I know that you've already received it, but for some of these individuals, they have to be pretty elated and relieved as well.
Well, I think so. Everyone's anticipating their turn, right? And when we think back to those discussions about how, I think we even had some discussions on the show about whether or not people would get the vaccine. Now you can see once it becomes available, everybody's anxious to get it. And we know that there are many loved ones, many seniors that have been in line and they're anxious to get it. All I can reinforce is we've made it this far. Let's not lose sight of the kindness and gratitude that has delivered us through this pandemic. And by all means, the folks that are here are trying to be part of the solution. They're definitely not part of the problem. So wherever those slowdowns are, it's well beyond the control of the staff that's here today and the staff that's been supporting it.
With that, I think I did see a study, the new study that came out is more than 80% of the people now are saying that they do want the vaccine. That's raised considerably over the past couple of months. Johnson & Johnson saying today that they could have clearance on that 1 dose shot as soon as the end of February. And I will say, Chief, that's the one I'm waiting for, because if I don't have to get 2 shots, I don't want to.
Sure. Well, and the thing is that's great about this. So the folks that are scheduled for their first shot today, they're leaving here knowing that 21 days from now, another Friday, 21 days from here, they're going to be right back here at Fire Station 1 for their second shot. And we're going to have a feeling it might be a little colder on that the way things are going, but we're going to be ready for them, and we're going to continue to make sure that we can help in any way we can to get shots in the arms of Oakland County residents.
Hey, so with that, Chief, do you want to talk about the discussions about how it came about to use the firehouse, and will this continue throughout the through the summer months as well, if needed?
Well, I think the big thing behind it is they're trying to, one of the multitude of reasons, but just one that I'm aware of, is this really keeps everybody isolated. So we don't have a group of people all trying to walk in and wait in a line and keep them distanced. By you staying in your car, we're able to achieve that physical distancing that is so very important, and you're not touching any high touch surfaces on the way in and out of a building. So there's advantages to this. And again, I think the biggest one too in this kind of weather is just that you stay in your car. Everything is well salted here. We got a safe campus for this to happen on. We got the support of West Bloomfield Police on Orchard Lake Road. It really is a nice solution, and we're getting good feedback from the staff here. And I see plenty of waves and smiles as people are exiting the property. They're glad they have the vaccine.
It's great that you guys are doing this and being able to be a part of the solution as well. And so we know it's freezing cold out there today, not a good day for the weather, right?
Well, that's the other thing is you see if you're able to see any of the staff walking by, they are ready for it. They are upbeat. They are sending a positive message about the vaccine. They're making sure everyone is screened. The nurses, they have a registered nurse that walks with a backpack through the parking lot monitoring. Everyone has a time on their windshield so the nurse knows what time they got their vaccine. And after those 15 minutes, there's just a little wave and away they go. And there really haven't been any problems here, nobody with a complication or anything like that. And if there is somebody, time, those cars, Tyler, they are ready for everything here, this Oakland County staff. And again, I can't say enough great things about them and what a pleasure it is to work with them.
Well, and that goes to you and your team members as well. Chief, though, I have to ask, on a day like today, were you worried that there could be additional accidents and your crews would be needed elsewhere, or did you staff additional people anticipating being able to service all parts of the fire industry today?
Well, what we did here is our operations is moved out of Fire Station 1. You won't see any fire trucks in here during the vaccine clinic. It would just be too chaotic with over 500 vehicles coming onto the property and running emergency operations out. So those trucks have been moved to one of the other 5 other fire stations in the township. There's going to be no change in operations as far as response. Those units are all available. But here's the point that I want for anybody who is concerned that their fire trucks aren't in this station. The fire department, the township, is committed to the overall health and wellness of our residents and the residents surrounding the greater West Bloomfield area. This is very much within our wheelhouse, very much within our focus of public health. And again, this is exactly what public buildings like this should be leveraged for, to make sure that we can safely get that vaccine into folks' arms and keep them healthy.
It really is one of the best ways to do it, because you do have a covered area for people to drive through as well, so that the workers can be shielded from the elements outdoors, because I know some of the earlier ones were in parking lots. And so you were having to go car to car as they were driving through. So this is really a great solution. So, but anything we didn't ask you, Chief, that you want to touch on? I know you're freezing out there.
Well, no, I'm dressed for it too. A couple things. There's no need to call the fire station and ask us what we're doing today or if you can get a vaccine, because the fire department is not scheduling those appointments. We're simply providing a building. So if folks are calling Fire Station 1, there is no staff here to answer that phone. Clearly, those are all non-emergency calls. Calling fire headquarters or town hall, again, unfortunately, we are not able to schedule folks. The other thing is if the clinic is ending at 4 o'clock, please do not come here thinking that there's going to be extra vaccine. They have this down to a science. They have a procedure for once they open a vaccine vial, if there's additional doses that they need to use. Nothing is going to waste, but there's no need for people to line up or show up in hopes of extra vaccine. It won't happen that way. There's a procedure that they follow.
It's good that you brought that up, because I have heard of people doing that in anticipation of thinking that there would be vaccines left over at the end of the day. And from what you were saying, everyone is pretty much keeping their appointment so far, despite the weather that's out there.
Oh, for sure. The parking lot's full. I can see cars backed up in both columns here behind me. And this is how it's supposed to work. And again, I know I'm so pleased that we didn't cancel this because there's a little bit of snow. We know our residents, we know the folks of Oakland County want this vaccine. And Ronnie, this is demonstrating that. They're saying, hey, it's Michigan, we're okay with the snow. We really want that vaccine and we want it to start working today. And that's what they're doing. That's what they're gonna do all the way until they get all 500 of these vaccines in.
Well, Chief, we so appreciate your time this morning.
Oh, you bet. Happy to be on. Thanks for sharing the message today with what we're doing here.
Well, and thank you all for doing it as well. And we want to again remind people, if you do need to try to get the vaccine, the best thing for you to do if you are in Oakland County is go to the Oakland County website and sign up. And they have the program in Oakland County where it's Save Your Spot. that is the best way to be able to get on the list and get the appointment, because they are only setting up appointments for the number of doses that they do have, and that number changes each and every week. So Chief Greg Flynn with us with the West Bloomfield Fire Department. We appreciate your time, Chief.
Okay, take care.
You too. We're going to take a quick break here on the Megacast. When we return, we're going to be bringing in our good friend, John McNamara, Vice President of Government Affairs for the Michigan Restaurant and Lodging Association, to check in with him. This is the Oakland County Megacast.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/contain-COVID.
Welcome back to the Megacast, the Friday edition of the Megacast on this snowy February morning. We are pleased to welcome back John McNamara. He's the Vice President of Government Affairs at Michigan Restaurant and Lodging Association. John, we have you on a lot to talk about these issues, but they change all the time as well. The good thing, the restaurants are back open.
We are. We're at, obviously at a 25% capacity at 10 p.m. curfew, but this is a great step in the right direction. And so far, the report's been positive of everyone doing their part and following the rules. And we're looking forward to more progress.
So, I've been online trying to navigate some of these reopening guidelines, because I will say, since the restaurants reopened, they seem pretty busy, at least here in our neighborhood. People were excited to get back to being able to eat out. One of the things, like one restaurant I went to, they had me sign in, the other one didn't. Is that still required? Is it mandated? It's still confusing for some of these restaurant owners.
So they are supposed to be collecting names when people come in. If you're with, a party of 4 or 5 other people, you can get one name and one phone number, because they'll be able to report back to the group. But the interesting thing is that they are not, if someone says, I don't want to do it, they don't have to refuse you service. It doesn't have to become an issue. So, you're seeing some places choose to put a QR code on the table and have people fill it out there, maybe go to a Google Doc or something like that. Some places you're seeing a simple clipboard. I was at a place here locally where when you walk in, they just ask you for your name. So I think everyone's accomplishing it in different ways.
Some of the names that people put down, though, they're pretty funny.
Yes.
Jenny 8675309 is pretty much every list.
Yes. And there's some interesting text back and forth from members of names people think of, or this, that, or the other. But I'm if it means I can sit down and eat in a restaurant, I'm more than happy to give people my name and phone number.
Right. I've been pretty surprised that the governor didn't extend it past Super Bowl, because of course the big concern is going to be Super Bowl and the parties. And I know some states are not allowing for TVs to be on, hoping to avoid those crowds. Any thoughts from the restaurants regarding the Super Bowl?
Well, they're excited to be open. I think there's a little bit of worry that, if it's a super close game or goes into overtime, they're going to have to, ask people to leave at 10 o'clock. And I don't think anyone wants to do that. But I think this is just another opportunity for them to prove that they can follow the rules. This can be done safely. And they're ready to have 25% in there and hopefully get some good tips for their staff and their teams.
Yeah, the outdoor igloos, we're seeing some places now because it's hard to get the igloos. Oakland County did a great job though in getting the garden sheds for some of the local restaurants. So a lot of this are, it depends on the county and also your city as well, working with some of these businesses. I don't think those are going to be going away. I have heard there's been some issues with the igloos because, with the snow, it's like the pressure and they start to rip. So some of these things have been creative solutions, but not long-lasting solutions.
Right. And, we don't want them, hopefully don't have to be super long lasting. I think our goal now is, we've had some really good conversations with Health and Human Services and, obviously a new director who recently took over there, but has, hit the ground running and had great communication with us. So, I think we want to get toward, 50 and then maybe get, as spring and summer hit, 75 and dare I say it one day, 100% indoor capacity. And we start to remember life as it once was moving forward.
So with that, with the new leadership, we are also hearing from other organizations that the communication seems to be a bit better in that regard. How long do you think some of these restaurants are going to have to be at 25% capacity?
I think that honestly depends on, we'll probably get some new numbers on Tuesday on infection rate and the other, but, I think it will depend on that. But, I would hope that by, late February, early March, if we're not at 50, we know when we will be at 50 and then, continue to move forward from there. Obviously, no one can control what's going on with this second variant. It's a concern for everyone, but a huge concern for us of, we want to avoid another potential, complete shutdown, but obviously you need to be cognizant of public health and protecting people.
John McNamara with us here on the Megacast. He's the Vice President of Government Affairs for the Michigan Restaurant and Lodging Association. Can we talk a little bit about employees? Are restaurants able to get enough employees? Because we are also seeing some people giving up on the industry because it is so up and down and so uncertain.
It's tough right now. I mean, it's been a hard year. It's been a hard year for our members, but it's been a hard year for team members as well because, they haven't had a lot of predictability. So we have some members who their teams came right back and were ready to get back and couldn't wait to see colleagues. And we're seeing some people who, really are struggling to get people back. They may have gone to, Target or a retail store where the employment was more consistent and moving forward. But, luckily, this is a lot of people's, first job or sometimes their second chance. So, if people want a job right now, the restaurant industry's ready for you.
And definitely hiring. I will say, for the most part too, any new complaints coming out? I mean, I know some of the restaurants have only been open a few days about people. Are we still in the dispute phase of people not wearing masks or they are wearing masks, or we're kind of beyond that now because people are so used to it?
No, I think masks have been normalized and people have sort of accepted. In fact, now, obviously you're seeing the movement that, 2 masks is maybe inching toward the norm. So we haven't heard any complaints about, from members of not wearing masks. It's not too much to ask to have someone say, until you sit down, wear your mask. And if you get up, put your mask back on. So that's no problems with that as of yet. And I do think part of that is, I think the 10 p.m. curfew helps. I think you have people who want to, get in and get out and they aren't lingering as much as maybe they once were.
So I'm looking at the order right now, the indoor dining guidelines that was put out by the state of Michigan. And the one is you have to wear a mask except for when eating or drinking. And that's been some confusion because people were thinking, do you have to put your mask on in between bites or drinks, or no, if you're sitting down, you're okay to keep your mask off?
If you're sitting down, you're okay to keep your mask off. And I think right now you're not seeing people, maybe do, the longer indoor 2.5, 3 hour dinner that they once were at a higher end place. I think now it's more, let's go, let's enjoy each other's company. But we're not seeing people linger as much as they used to. And part of that is they understand that at 25%, every seat is valuable, and they want to give the restaurant, the opportunity to turn that table and make some more money.
So with that, the 10 p.m. curfew, what is really the purpose behind that? Is it to avoid those late night crowds because that's when people tend to gather more?
I think that's part of it, but I'm going to be honest. I think a lot of it is that it gives people less time to drink, and the more you drink, the more irresponsible or lax you're going to be, and I think that cuts down on that. And I live in East Lansing, and I think you're going to see college kids go out until 10 and then take it back home and have the house party and sort of do it in reverse. But I really think it's more of a crowd control issue than anything else.
So any chances of that being lifted anytime soon with those capacities?
I think you'll see I think the curfew you will see for longer. I think if capacity limits go up, you'll continue to see a 10 p.m. curfew for a while.
What's the feedback from your members on that? Are they saying, okay, well, at least it's something?
It depends on the member. If you're, a sports bar, you're probably okay with it because, a lot of stuff is wrapping up by 10. But if you're more of a nightclub type facility or more of a, a later college crowd or more an industry bar where people would go out after work, they don't love it because they're sort of missing out on their, bread and butter, which for some people is 10 to 2 or 11 to 2.
Yeah. So, John, what's been the feedback from some of your members regarding some of the grants that were issued for the employees, the workers, but also the businesses? Because, you see them put this out there, but have people actually been able to receive some of this money?
So in terms of the employee grants, we actually administered those through our foundation, and we got over 90,000 applications from people all over the state. So we are going through right now and, weeding out people who don't live in the state of Michigan, somehow improperly filled out the application or applied multiple times. For example, we had 78 people use the same address. It's an 1,100 square foot house. So obviously some fraud we need to go in there and weed out. So those will be all, people will be notified by the end of this month if they did receive the award. So I think people are somewhat frustrated that they apply and haven't heard anything. But, we have to make sure that we're not, giving away money that should go to, someone else.
And you know what? It's like a shame on those people trying to take advantage of the system because there are people out there that really need it. And, I know that we've seen it earlier on as well. And even on the federal side, they went after some of these businesses, the business owners that were taking advantage of the system as well. So shame on them. It's frustrating, but unfortunately part of the world we live in now that, you've got to double and triple check to make sure that happens. And, again, our focus now is hopefully we don't have to do any more grants. Hopefully, we can just continue to open up more and more and more, and they can start paying their bills by selling food and drinks. Exactly. With that, so we focus a lot on the restaurant industry, but you're also part of the lodging association. How are things going for hotels? Because we are in the winter months, but people do like to go up north. How is that side looking?
So, lodging has struggled just as much as restaurants have because, the two are so synonymous. If you're staying in a hotel, you're probably going out to eat. If you're going on vacation, you're obviously staying in a hotel. So, they were very encouraged by sports being allowed to operate yesterday because, hockey tournaments, basketball tournaments, gymnastic tournaments, that's a great source of revenue for them. Obviously, we're getting snow. So, up north is excited to start to see people there. So, but, the comeback's going to be a long time for them as well. And, they face unique challenges and, telling people, in a 10,000 square foot ballroom, you can right now only have 10 people from 2 households is frustrating. So that's another change we're working on making is to get that to, back to the 20% per 1,000 square or 20 people per 1,000 square feet. That's, so they can try and scrape together some meetings and some business.
And, and when it comes to the households, who's actually checking?
No one.
Because I've been in some of these, like the garden sheds, and no one in there is from the same household. You know, it's how you're getting out with your friends.
Yeah, absolutely.
So, I've been wondering too, since you brought up sports, we know that a lot of people have been going across state lines in order for their kids to be able to play sports. So you think about that and how much money some of the hotels and the restaurants have been losing because of that, because they've been going to other places. So hopefully that will help open up that avenue here in the state of Michigan.
Yeah, hospitality employment is actually up in the state of Indiana right now because, you know, being a border state and people have migrated over there, some of them to get jobs. Because, you know, Indiana's been pretty open throughout all this.
Yeah, and I know that I have friends that they take off and they go to Florida. And whereas before they would have only stayed maybe a week, they've decided to stay 3 and 4 weeks because so many people can remote work right now. Right. And they're like, not only just the weather, of course, you know, but on top of that, they want to be able to go out to eat to restaurants and, you know, kind of get back to life. And so they're like, if Michigan shut down, you know, if I have the means, I'm leaving. I'm out of here.
Absolutely.
So with that, John McNamara with us. He's the Vice President of Government Affairs for the Michigan Restaurant and Lodging Association. John, anything we didn't touch on today that you want to continue to share with people? Because I do feel like this information changes constantly.
Yeah, I mean, I think we covered everything, but just, you know, one more, you know, public plea for if people go out, be kind to your server, understand that it's going to be a little bit different and it's going to take everyone working together to continue to get to, you know, increased capacities and maybe later hours, and looking forward to warmer weather to help.
Right. Be nice, tip well. Yeah. I will say though, I'm waiting for like the summer months, because I think some of these restaurants, when we get back to regular, we'll start to see some of these garden sheds, igloos for sale on eBay. I want to snag one.
I think you're going to see that. And then, you know, I think you're going to see some stuff's going to be forever. I think the QR code menu on the table is going to be something you see continue, rather than handing a paper menu.
Well, yeah, just from an expense standpoint as well, it's got to be a lot cheaper for the restaurants, right?
For sure. Yep.
I will say we have a local restaurant here that does that, but for some reason I don't get a good cell phone signal inside their building. And so, you know, you're like doing this, you know, it's like trying to get on. It could be a little frustrating, but it is a good way to do it.
For sure.
Well, John, great to have you with us. We wish you the best in 2021. Let's hope we're on the back end of this.
Absolutely. Hope to see you guys next time.
Okay, take care.
Thank you.
We're going to take a quick break here on the Megacast. When we come back, we will be joined by Dr. Jessica Garrett. She's with the Birmingham Maple Clinic. This is the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Parks COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on, to help stop the spread of COVID-19, wear a mask.
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 The ball's in your court, Michigan.
Great to have you with us here on the Friday edition of the Oakland County Megacast. I'm Ronnie Dahl in my home studios, while Mr. Tyler Keith holds things down back there in West Bloomfield. As a reminder, you can always catch us on Civic Center TV, Birmingham Area Municipal Access. If you have cable, thank you. A portion of your fee helps support programming such as this. You can tune us in on Channel 15 if you have Comcast 99 on AT&T. And then today you can also catch us on the Facebook page of the Orchard Mall. We want to say thank you to them. And of course, as always, you can tune us in on the radio 89.3 Lakes FM, 88.1 FM The Biff, and radio, social media, as well as TV. That's what makes this the Megacast. With that, our conversation today, we're going to shift a little bit and bring in Dr. Jessica Garrett from the Birmingham Maple Clinic to talk more about ADHD. And so with that, Dr. Garrett, great to have you with us.
Thank you. Good morning. Thanks for having me.
So I've been wondering about some of the kids right now and the lasting impact that this pandemic is going to have on them. Have you been seeing and treating more people because of the pandemic for ADHD?
Definitely. We've seen a huge increase in referrals just in general, but as far as evaluations go, and for ADHD specifically, we've noticed a huge uptick in that. Absolutely.
So for those, if we can kind of just backstep a little bit, what is the clinical definition of ADHD?
So the clinical definition is there's 3 types of ADHD, and it's all ADHD now. It used to be there was ADD, but now ADD is ADHD inattentive type. So we have ADHD inattentive type, and that's just, lack of focus, difficulty concentrating, easily distracted. And in children, and especially in girls, this is oftentimes overlooked because these are more of like your daydreamers. Their behavior is not really acting out. They're just kind of lost within themselves. The other type is the hyperactive and impulsive type. And those are the ones that stand out and tend to get noticed right away. So, constantly getting up, talking a lot, interrupting others, difficulty with impulse control, that's what that kind looks like. And then the third type is where we have a combination of the two, inattentive and hyperactive and impulsive.
Yeah, I always think scatterbrains. Right?
Yeah, that'd be accurate.
So with that, what signs should a parent look for, and when do they know to get help? Yeah. Or is it just like a mild case, if there is such a thing?
Yeah, there's definitely such a thing as a mild case. And I think we've seen a big increase in, evaluation requests because parents are seeing their child, Zoom from home, and they're like, whoa, this is really difficult for them. So I think when parents need to look for help is when their child is really struggling. I've had parents bring their children in for assessments where the child was the one who said, I need some help. So when parents see their child struggling, when they notice that maybe they're different than their peers, that they're having more of a difficult time focusing, then it's always a good idea to bring them in to see if it, actually is a diagnosable condition.
So with that, if someone is diagnosed, what is the treatment?
Yeah, so treatment looks different for everyone, but some general treatment recommendations that we always discuss are, medication is one option. And there is, some proven medication that works for the treatment of ADHD. Psychostimulants are usually the first form of that. And then also just behavioral therapy. And then structuring their environment, right? So, and that's what's been difficult with the pandemic is, and I think why we've seen this huge uptick is between adults and children, you kind of had these natural boundaries in place. When you were at work or when you were at home, you went to your desk and you were at work and you were able to focus where, all of a sudden these boundaries were kind of taken away. So without those natural boundaries in place, it's been difficult for a lot of people. So with environmental issues, we're looking at just, making your environment as organized as possible, as structured as possible, as routine as possible, for children and adults with ADHD. That can be, a huge help. So, and then in combination with parent management training for children, helping the parents kind of manage, what their child is capable of and just helping them, be as successful as they can.
So if this is something that has become somewhat of a new behavior for kids, as they start to go back to the classroom, could it go away? Is that what I want to say? I mean, if they get back into that routine of going back into class, and the same for adults as well, if they get back into the office.
Yep, Ronnie, that's a great question. And what we look at is if it's actual ADHD, it's a neurodevelopmental disorder. So it would not go away. It could maybe subside a little bit with, the correct interventions in place, the correct school interventions in place, the correct interventions in place in the workplace. But we wouldn't expect to see it completely resolve. And if it did, and if this is, if pandemic learning is the first time that you've ever heard of any issues with your child or seen that it's probably not ADHD, and you can just kind of tighten their environment up a little bit and make it better for them. A lot of children are struggling with online learning because it puts a lot more on them, and parents as well.
Yeah, some people learn better online and some people don't. And so before a parent tries to get professional help, is there a self-assessment test that they should be doing, either for themselves or for their kids?
Yeah, so Google and the internet is both a blessing and a curse, right? And with ADHD, it's no different. So you'll Google it and there's a ton of information out there, and some of it is great and some of it is not so great. What I always direct parents and newly diagnosed adults to, or even if they're wondering, is CHADD.org is a good one. That's CHADD, that's children and adults with ADD. CHADD.org is a good one. And then Adhd magazine, that's another good one. And as you're looking at, you can even just Google, diagnostic criteria for ADHD and see, do I meet these symptoms? And we're looking also for, are these symptoms pervasive and are they persistent? Is it, really something that's impacting your work, your functioning in daily life?
So I'm thinking you probably hate it when people say, well, according to Google, this says this, or I was on the internet, right?
Right. Yeah, it's good to do your own research, but just make sure you're looking at good resources.
Right. So is this something that could get worse? So if a child is already maybe being treated, can it get worse? And and what does that look like if that does happen?
Yeah, it can certainly, the presentation can change, right? And oftentimes they'll have to experiment with interventions before they find, what works specifically for their child. So you could see it get worse before it gets better. So you could see maybe an uptick in, a lot of children with ADHD have difficulties with behavior regulation, with emotion regulation. And so when they feel things, they feel them strongly and they have difficulty with impulse control. So you may see some acting out behaviors. So that's what we really aim to address in treatment, and with just even assessing it in the first place. And for parents to be able to have resources to look at some, manageable strategies when dealing with their children.
I'm just thinking about what it must be like to be a parent right now, because, so many people, if they're working from home, but then their kids are having to be a teacher as well and trying to navigate this world and to try to say, okay, when do they need help? When do they, maybe not need help? And it's got to be so hard for everyone right now.
Absolutely. Yeah, it's a lot, but I'm right with you. Parents especially, they're juggling a lot of balls. So it's, can be really challenging. And especially when you add, a neurodiverse youngster to the picture who, maybe presents with some emotional and behavioral challenges, it just, makes it all the more difficult.
And how about the schedule though? When we're seeing how some of these schools have had to go in person, then remote, and then back in person, and then it's half days, does that help contribute to some of these issues?
Absolutely, because when we're looking at, ADHD or children with emotional or behavioral difficulties, predictability and routine are something that we can usually offer them that helps them to be successful, right? And through, nobody's fault, this predictability and this routine has really been snatched out under them. So that can lead to an increase in symptoms because they don't know what next week is going to bring. Parents don't know what next week is going to bring, as far as what is learning going to look like.
Oh, Dr. Jessica Garrett with us here on the Megacast. She's with the Birmingham Maple Clinic. With that, what are some of the other services that you and your colleagues treat there at the clinic?
So we see a lot of anxiety, depression, thought disorders, mood disorders. We offer, therapy as well as psychological testing and assessment. We have a couple of psychiatrists on staff who do, medication review and updates. So yeah, we're seeing a lot. We're seeing a lot of different, presentations.
So with that, if anyone is listening or watching right now, what advice do you have for them?
Yeah, so advice that I have for them is to, if you think you need help, then it can't hurt to seek out an evaluation. Through the purpose of evaluation, through what I do with psychological assessment is really try to pinpoint holes, but also look at strengths, right? So if you do some, Google research and find that, perhaps it's worth looking into this further, an evaluation can be immensely helpful. And then to just tighten up your environment a little, as much as you can. And I always tell parents and adults to just be graceful with yourself, right? Don't be too hard on yourself, and allow yourself grace, allow yourself that it's not, all going to be perfect, that there's going to be some missteps, and that's okay.
I think what's been so hard about this is it's been so long. Because think back to last March, it was like, for 2 weeks, then 2 months, and now we're nearly 11 months into this. So it can get a little bit harder, not just for the kids, but their parents as well, to try to get to struggle with everything that we're going through here in our country and globally as well. With that, your services, is it referral based? How does that work?
Yeah, so our services, we do see people by referral. We see people directly when they contact the clinic. We see, people are sometimes referred by their primary care physician, or, an outside psychiatrist or therapist. And so referral wise, we see, either direct referrals, or if they're referred, by someone else.
Dr. Jessica Garrett with us here on the MegaCast. Doctor, before we let you go, anything that I didn't touch on that you want to share with our audience today?
No, I think we touched on it all. I would just like to highlight again, just to, be graceful with yourself and those around you. And, I think we are all struggling at some level. It just varies with all this uncertainty that has happened the past, almost year. So to just, and then to reach out for help if you need it. There are resources available for you if you need it, for you or your family.
And we have definitely all learned during the pandemic, it's okay to ask for help. And hopefully one of the good things that comes out of this is it's removing the stigma attached with asking for help. So we so appreciate your time today.
Thank you. Thank you so much for having me.
And Happy New Year, and get out and enjoy the snow.
Thank you, Ronnie. Happy New Year.
Dr. Jessica Garrett, again, Birmingham Maple Clinic. If you need help, ask for help. We're going to take a quick break here on the MegaCast.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And Step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Michigan, The coronavirus pandemic has put us all to the test, and now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus-test. A message from the Michigan Department of Health and Human Services.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal. We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local.
Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together. Together.
For the latest information, visit oakgov.com/COVID.
Great to have you with us here on the Friday edition of the Oakland County Megacast. As a reminder, Tyler and I are here Monday through Friday, 10 a.m. until noon. Our show is a little off schedule today because we wanted to get to Chief Flynn at the top of our show at the vaccination clinic there at Station 1 in Orchard Lake. But so we want to go ahead and touch on the headlines here today. Of course, the big news, Governor Gretchen Whitmer announcing that high school sports leagues in Michigan will be able to begin holding practices and competitions on Monday. It's another sign of the state's improving COVID-19 metrics. The announcement came after a weeks-long push by the parents and student athletes that has included protest, committee testimony, and Wednesday a lawsuit as well challenging the ban on contact sports, which had been scheduled to remain in place through the 21st of this month. The campaign has been operating under the name Let Them Play. As you may remember, we did have Mark Hall with the organization. He is also a parent on earlier this week. Now, under the new order from the Michigan Department of Health and Human Services, masks are to be worn during practices and competition. If masks cannot be worn, participants must be tested on a regular basis for COVID-19 consistent with the guidelines. Asked what impact the Let Them Play demonstration on Saturday had on her decision to allow sports. The governor said none, and that she's been clear that they are going to follow the science, and that's what we have been doing. But the good news there, Tyler, our high school athletes are going to be able to start playing and competing.
Yeah, good news indeed for the high school athletes and for the schools themselves. They're going to be able to continue their sports season, albeit with restrictions in place and guidelines in place for how to conduct competitions and conduct practices. Wearing masks when you are not in the competitive action is going to be a key part of that. Bringing back that testing program that they previously had in some capacity is also going to be part of that to ensure that these regulations are working. And the governor was even asked at her press conference yesterday, which we picked up live here on Civic Center TV and Lakes FM. She had even been asked if she would hesitate should there be any complications to pull the plug once again. And she didn't give a definitive answer on that question, definitely for PR reasons, considering that may have been a strong factor in why these restrictions were lifted altogether. But I would imagine she wouldn't be hesitant to pull the plug if these regulations that are in place do not work, because there are already concerns that were in place due to so many of these winter sports being indoors. So
Michigan lawmakers are allowed to jump to the front of the vaccine line. As thousands of seniors scramble for the coronavirus vaccine, some politicians in Southeast Michigan are jumping to the front of the line with help of their local governments. Oakland County and Detroit have offered the vaccine to politicians, with Oakland County offering it to state legislators and county commissioners, and Detroit offering it to legislators and city council members. Macomb County is also allowing elected municipal leaders to sign up for the vaccine as well. The decisions to prioritize public officials appears in conflict with the established priority groups that currently favor people 65 years and older, and of course, frontline workers. Now, Oakland County confirmed it had offered the vaccine to state reps, senators, and county commissioners, saying they were part of the vital public interest during the pandemic. Michigan gives counties and municipalities some discretion in administering the vaccine, so there's really nothing illegal about giving it to some of the politicians before some of the seniors. I would think some people may have an issue with that, Tyler.
Yeah, I think that's good. Definitely going to be the case. People are going to have issues with these populations that are very much at risk, not getting the vaccine necessarily before, or getting the vaccine in between these people that are working in state and other forms of the government getting those vaccines. That being said, having leadership that is in a safe situation is key to continue the continuity of government and the government protections. But I do have to question why our government officials cannot take extra precautions to prevent COVID-19 and wait their turn in line while some of these more at-risk populations are continuing to have to wait an extra long period of time, not only to sign up to get their vaccinations, but to actually get in line and physically get a shot in their arm. I think it's just a bad look for politicians to be putting themselves in line with or before some of these people that are in at-risk populations trying to get the vaccine.
So how did Michigan actually manage to flatten the curve against COVID-19? We've seen a dramatic reduction in positive COVID-19 cases, deaths, and outbreaks after experiencing a fall surge that prompted state health officials to expand the restrictions. According to data from the state health department, Michigan has decreased case rates by 72% from a peak in November, and weekly death tallies have declined for 5 consecutive weeks. A University of Michigan COVID-19 model now estimates that the impact of social distancing during the state's pause to save lives that did begin this past November prevented about 109,000 cases of COVID-19 here in the state of Michigan, 109,000. So with that, though, you got to keep in mind not only the pause, but you have people that are being more aware of using their mask and washing their hands a lot more and keeping that social distance. Also probably contributing factors to the reduction in flu cases as well, Tyler.
I put the wrong mic on. There we go. Yeah, I think that's definitely playing a factor into Michigan's ability to flatten this curve against COVID-19. Is as time goes on, people become more aware of these things. And I think that the stubbornness issue has certainly been reduced as well. I mean, talking to John McNamara earlier, you asked him about whether or not there still is that hesitation and that pushback from people that are going to restaurants about whether or not they should be wearing the mask or have to wear their mask. And he even said himself, there seems to be less hesitation or less apprehension to wear the mask. It's become part of regular life. So I think these measures we've been preaching on for almost a year at this point to prevent the spread of COVID-19 have become a bit second nature. And then on top of that, Michigan has had one of the most stringent COVID-19 regulations and restrictions in place throughout this pandemic, and that's also helped to prevent the spread, albeit not prevent frustrations, but the goal here wasn't to make everybody happy, but to keep everybody safe.
Well, you'll find those headlines and so much more if you just go to civiccentertv.com, click on the coronavirus tab, and that's where you'll find the latest headlines. But also at the top of the page, there are direct links to the CDC, the state of Michigan, Oakland County, and our local communities as well. It's a good way to try to keep up with some of these changing headlines, especially the state of Michigan. But also, if you go to the Oakland County website, you can track the cases in your neighborhood by your zip code. So good information there as well. We're going to take a quick break here on the Megacast.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/containcovid.
COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. MyBridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Megacast. You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. We are going to check back in with Chief Greg Flynn with the West Bloomfield Fire Department. They are doing a vaccination drive-through clinic at Fire Station 1. Chief, we spoke to you at the top of the 10 o'clock hour. Just want to do another quick check-in with you. Things still going pretty smoothly there?
Things are going great here. Again, I can't compliment the Oakland County staff enough. They really have this whole clinic thing down to a science. Everybody's in the right spot. Cars are moving through. Ronnie, they put through about 20 cars every 15 minutes through the vaccine clinic. So that is from the point that they check in outside of the apparatus room where I am right now at Fire Station 1, till they move through and all the way across into the south lot by the tennis courts in front of the high school. 20 cars that are moving through here. And there's just a steady stream that you're going to see keep coming in behind me here.
I know that there was probably a little bit of concern this morning when we saw the weather, but that seems to not have impacted people making the decision to honor their appointment and get the vaccine.
Right. As you know, there's a lot of demand for the vaccine. And I know that there's many folks that were saying, nuh-uh, I got my appointment. I'm going to take advantage of that and I'm going to make there. And really, again, Oakland County, on my commute in, I come from the far east side. Road commissions across the Tri-County area have done a rock solid job of keeping those roads safe. And it's no different here in West Bloomfield. Roads are very passable. If you have an appointment at any of the clinics today, I would encourage you to keep that appointment.
So, Chief, I know that for the most part, your work there is to provide the location. Members of the health department are doing a lot of the work with the actual clinic and getting the doses in. But is there any advice for people that are coming there for the first time that maybe you've seen other people not follow that you want to share with them if they are going to be coming out to the clinic later today?
Really, it is just arrive at your appointed time. That's when things flow the best because they have, again, 20 people coming in at every 15 minutes. So there's no need to arrive 30 minutes early or 40 minutes early to get into a line. We don't want any lines. We want everyone just showing up and moving right through. And again, I want to thank our friends at West Bloomfield PD who are out there monitoring Orchard Lake Road just to make sure everything keeps moving, especially keeps moving smoothly, especially on a day like today.
So with that, should people have someone drive them, or they're okay to drive after they get the shot?
They're absolutely okay to drive. Most people that are coming here are by themselves, although we have had some folks that both have gotten an appointment today. So they come in and the nurses just move to both sides of the car and 2 doses are in and, and away they go. So it's good. Again, I can't stress enough that you need an appointment to come here today. The phones have been ringing here occasionally at the fire station. We're not answering them. These are our non-emergency lines. We're not answering those phone calls because nearly 99% of them are folks asking if they can come here today to get a clinic and to get a shot. And the answer is no. There is no on-demand vaccine here. Everything's by scheduled appointment only.
Yeah, and I know, Chief, earlier you had mentioned people, even if they don't, some people are showing up at some of these clinics at the end of the day, anticipating that there would be leftover vaccines for maybe people who didn't show up. You're saying that's not the case.
Ronnie, they have this down. They're so good at this that literally the staff at the check-in is communicating with the vaccine folks inside the fire station. So as they get to the end of the day, they're calling in for the exact number of vaccines to be drawn up, because if they don't break and constitute that vial, then they're able to save that and schedule the more appointments and move that forward. So again, when you look at the number of people that need vaccine and how they have the science of administering this down so efficiently for people to show up, we just need to let the health department do what they do well, which is putting vaccine into people's arms. They're coordinating here. They actually, Ronnie, they're running an incident command system, which really makes guys like me smile, because they have a person here that is the incident commander. There's different chiefs, if you will, within the roles here. They rotate through their breaks, and all of that is done so there's not one delay in moving cars in here. You wouldn't even know that it's happening because there's no delays, and they keep their staff fresh, they keep them warm, and they're keeping vaccine going into arms.
So, Chief, how often will you be doing this at the fire station?
Well, this is what we would call what I would call on our schedule here for my team, a first shot clinic. So there is going to be a second shot, and it's 21 days from now. So we know when we commit to one of these that we're committing to another clinic 21 days from now. So when Oakland County Health calls up, we say, how can we help? That's what we do, because we know that that our residents have loved ones that live in Bloomfield Township and in Commerce and friends and family. So anything we can do to put a clinic available for anybody in this zip code or surrounding zip codes to get here, the WBFD is going to do that. And we have the full support of the Township Board to put resources like the police department, like parks helping us out to keep the parking lot safe, like water and sewer lending a hand to put down some additional rock salt and use their bigger trucks to do that. It's a team effort in the township to help the health department get these vaccines to our residents.
It's probably important too for the people who came to one location to be able to come back to that same location to help relieve any confusion about where they go for that second dose.
I think it's very good idea with how they're scheduling that. So now everyone says, oh no, I know the routine. I pull in to this entrance and I go across by the parking lot, by the tennis court. So they're familiar for that second round. And you're right, that brings a little bit of comfort and reduces the anxiety for some folks. Really, the most challenging part, Ronnie, is the nurse over there prefers everyone to back in. Now, this is one thing when you go to a fire station, you'll notice most of the firefighters back into their parking spots. Well, this isn't something that all people like to really do, back into a spot. So if there's one high risk, and I say that with a smile on my face, it's over in that parking lot where we're having people back in so that the nurse can see everybody through the windshield. And that's the rationale behind that. They haven't cracked the window. The nurse can walk right down the center of the parking lot, see everybody to make sure they're okay. And then if everybody is in distress, they simply tap their horn and the nurse will move right to them and render any assistance.
And it's great that you also have people there as well, that if there is a need to get some help, people are on hand to be able to help those individuals. Hey, Chief, you guys have been on the front line of this pandemic from the very start. You don't have the option of working remotely or not going into work one day. What's it like for you personally and as a leader to be able to see this? Is it hopeful for you?
Very much so. We've been saying that this is coming. You know, I have a great deal of confidence in the system. Where I get frustrated, Ronnie, is where folks start to come in and they want to nitpick little pieces of it out. When if you look at the totality of what has happened since, March of 2020, wow, that's what I say. Wow, look at what we've accomplished. Here we are. We were letting nobody in the fire station months ago. And now what have we done? The fire station is one of the places where we want people to come to get that vaccine. So we need to spend a little more time celebrating the successes of over 500 vaccines going into arms today, instead of focusing on the fact that there may be a little snag in the distribution from the manufacturers. It doesn't matter. We are controlling what we can control with Oakland County Health, with the township officials here, and we're making the best out of it. And we're going to keep doing that day after day after day, because it's what we do.
Yeah, and a lot of it too is we have to remember we haven't done this before. I mean, it's been 100 years since our last pandemic, and what we are lucky for this time around is to have the technology that we have. Because could you imagine, even if this was 20 years ago, or we had those bag phones, cell phones,
sure.
This would be an entirely different conversation.
Well, and Ronnie, I'm still wearing my mask. I've had both shots. I'm well beyond 2 weeks of my second shot. I'm at the highest level of any kind of efficacy that I'm going to have with a vaccine. But I still want to model for folks that this is what right looks like. And I'm going to continue to wear my mask until it's time that the leadership says, hey, we can dial this back, that we need to. Still washing my hands, still trying to keep some distance. I very much look forward to going out to dinner when that is, again, the restaurants around me open up and it's safe, because I see waitresses and waiters that do a good job. I see responsible business owners across the greater West Bloomfield area anxious to provide a safe environment for their patrons to come in. And that's what I'm excited about. And that's what I'm so glad, things that you guys highlight on the show, what we're doing well. It's so easy to pick apart when we're not being as successful as we want to be, but there is so much good that's happening. Thank you for highlighting so many of those stories.
Well, and the great thing about this too is it looks like the Johnson & Johnson vaccine is going to start being available by the end of February, fingers crossed. And again, that one is a one-shot dose, which is going to help get more people vaccinated even quicker. So Chief, we appreciate your time. I will say it's kind of weird for me to be on this end, to be sitting in a warm home, drinking coffee while you're out there freezing, because I remember years being on your side of the camera.
Well, it's a good day here in West Bloomfield. Again, I just really encourage people, be patient, be kind. Everybody around here, the hospitals, all of the clinics are trying to get as many people in as you can. So just understand that we know everybody has a compelling story. We know everybody wants to get their loved ones a vaccine. Your turn is coming. Be kind, and we'll be grateful when your turn does come.
And also people should be aware of the additional traffic there on Orchard Lake near the fire department as well.
Thanks, Ronnie.
Well, Chief, we so appreciate it. Go get warm. Enjoy a nice hot cup of coffee. We appreciate your time today.
You bet. Take care.
Chief Greg Flynn with us here on the Megacast. He's with the West Bloomfield Fire Department. Of course, they are doing the drive-through vaccination clinic there on Orchard Lake by the high school at Fire Station 1. So if you see additional traffic in the area, please be aware of that, but also do not stop. You need to have an appointment, and you can get that appointment in Oakland County. If you go to the Oakland County website, it's Save Your Spot. So we're going to take a quick break here on the Megacast. Still a lot to get to in the 11 o'clock hour. When we come back, we'll be speaking with a local restaurant owner. This is the Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet Wear facial coverings when you leave your home and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask.
Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal. We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local.
Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together.
Together.
For the latest information, visit oakgov.com/COVID.
Welcome back to the Oakland County Megacast. I'm Ronnie Dahl at my home studios while Mr. Tyler Keefe holds things down for us back in West Bloomfield. Excited to bring in our next guest. Brad Greenhill is the chef and owner for Takoy, Detroit. How is the restaurant doing right now? Because you guys aren't back open for indoor dining despite being allowed to do so, right?
Yeah, we're doing okay, kind of treading water, if you will. We just do carry out and take out and delivery. And then we also, we're doing a pop-up in Ann Arbor next week. And we also do like a monthly meal subscription kit that, we have probably about 160 subscribers to. So it takes like some bandwidth. So we had all this stuff on the books. So we're like, we didn't want to like overstress ourselves. So we're like, let's get the restaurant clean and get these out of the way. And then we'll open, at the end of the month.
So the pop-up is kind of going back to your roots because you started out of a food truck.
Yes, I did pop-ups for years and was probably one of the first pop-up chefs in like Southeast Michigan, started back in 2010, 2011 doing pop-ups, and then had a food truck. So yeah, and we did before we opened the Takoy in Detroit and Corktown, we had done a pop-up in Ann Arbor for 6 months at an old restaurant space there. So it's that's how they know us in that area, and so it's been, kind of fun to get back there. One thing with the pandemic, in Detroit, a lot of the restaurants are kind of destination, so we're getting people from Royal Oak and West Bloomfield and Birmingham and Ann Arbor that come in, to visit the city, and not as many people are visiting the city with the pandemic. So it gives us an opportunity to meet that pent up demand by taking the food to people in their area,
You have such an amazing menu. How do you come up with some of your dishes?
Well, some of it is a lot of it's based on I would say it's 25% based on traditional Thai dishes, that we put a little bit of our twist on. And then a lot of it is just sort of taking the spirit and ingredients of Thai food and making it, I would say kind of more Midwestern, just because that's where we live. So, we play around with barbecue and some of the stuff that was very common to Midwesterners, but we do it, through with a Thai pantry and using some Thai techniques. So.
Well, if you ever need a taste tester when you're trying to come up with these new recipes and these new dishes, feel free to call me up. You don't even have to pay me.
Come on down. Right. Be careful what you ask for.
So I when I saw you on the list to interview, I was like, you want to talk about someone that you really are a survivor, because you guys started as the food truck, but then you open up, and then you have an arson, so you have to rebuild.
Yeah.
And now we have a pandemic.
Yeah. Yeah, it's been definitely a crazy ride, and a couple people have interviewed me from like national publications before, and they're like, "Why didn't you just quit?" I would have just quit. And I was like, I don't know what else I would do, you know. So yeah, it's just, you know, I have a lot of love for what I do and what our team does, and so, you know, stopping has never been an option. It's, you know, I guess being an engineer, I have like a problem solving brain, you know, and so it's always getting put to the test.
But how did you get into cooking?
When I went to college at U of M, and when I was in college, I got interested and wanted to learn how to cook. And so I started just doing it as a summer job when I was in college. And then I just kind of stuck with it, left it for a while, had a computer graphic design and web development company for a little bit, but then missed cooking, missed like being on my feet, you know, and not sitting at a computer all day. And so I got back into it.
Wow, it really is fascinating to think, you know, from computers to cooking. I mean, yeah, it really is.
Some people like, and they're like, "Oh, you went to engineering school," and I was like, "Well, if you think about it, it applies to it, you know." And the way I sort of like put together dishes and stuff is not so much inspiration, but it's science based a little bit, you know. I think about how foods work together and how flavors work together and stuff like that, and it's very much. There obviously there's some creativity to it, but there's also there's a lot of science behind it.
So in with that, what have you learned from the pandemic that you think is going to be for the best that maybe you'll carry into the future?
I think, well, one is just being more like nimble and being able to pivot, and also the importance of like operating with a little bit less overhead and a smaller capacity. You know, I think we had, before the pandemic, we had, you know, 2 restaurants, talking about opening a 3rd restaurant, and we had 80 plus employees, and, you know, now we're down to 12 employees in 1 restaurant. So and what that has allowed us to do is be kind of nimble. And we've sort of approached the whole pandemic, every time there's been, you know, a relaxation in the restrictions, or, okay, you can open again. We've never tried to grow too much more. We've tried to be able to maintain and be sufficient and profitable as small as we can, so that we can sort of navigate, you know, we can pivot whenever we want, you know. And so if there's another shutdown, we're okay. We don't have to lay people off, you know, and then as things get better, we'll start to try and grow again, you know. So.
Yeah, because as we go forward and the restrictions are lifted and we get back to some type of normal, will you ever feel comfortable expanding again? Because will it be like, oh, there could be another pandemic around the corner?
Right. I mean, I don't really like to operate that way, but it's definitely a thought, and it's definitely about how do we make the business work in different ways, you know. And I think we've been able to tap into certain things that we won't let go of. Like, we never did carry out and delivery before, you know, and then we will keep it going now. You know, we didn't consider things like doing subscriptions and meal kits. And these are avenues that I think people will still be interested in after the pandemic, you know. So
I think the meal kits, I mean, really, that's fabulous. There are very few smaller restaurants that are doing that. But I will say, like, those home chef meals taught my husband how to cook.
Yeah, and so during the first shutdown, when we were closed, I wrote a book for that 3 or 4 weeks, you know. It's not quite finished, but I was like, I compiled all our recipes, and made them for home cooking. And what do I do with them? You know, when I have time, maybe I'll try and get it published. But so what we've been doing is releasing them, you know, 3 a month with these meal kits, and people can cook the dishes at home. And we haven't made it quite as from scratch as what we do at the restaurant. So we make it a little bit more accessible, so it doesn't take you 12 hours, you know, to make dinner. Try and get it so that you can make these 3 dishes in like an hour or so, you know, so.
Well, with that, Brad Greenhill with us here on the Megacast. When you reopen at the end of the month, 25% capacity, is that going to be enough to help you sustain your operating budget?
Well, it's obviously not ideal, but like I said, we're barely maintaining right now, so it can only help us, you know. I don't think our carry out, it'll fall off a little bit, but not a lot, because there's still a lot of people who won't even go out to dinner, you know, who are comfortable with the carry out model. But it will allow us to have people in the restaurant, and being 25% in February isn't that bad. And the way our restaurant is laid out, it's not actually less than what we were doing when we were 50%. Just because of the configuration of our restaurant, we have booths. And so at 25%, we only lose 1 table or 2 tables from what we had when we were doing 50%. So it's not great, you know, I'm not gonna lie, but you know, we keep rolling with it, and we'll make it work, and we'll see what happens.
So as you had mentioned, you are in Corktown, and Detroit is a destination for so many people. And I feel like some of our local restaurants that are in the neighborhoods have been able to, you know, survive a little bit easier than places such as yours, because it is that neighborhood bar. And now Corktown is doing a great, like that whole area is booming with the new residents and things.
Right.
But how much support are you getting from the local community there?
I would say during the week, that's pretty much all, you know, probably 90% of our support comes from locals, and we still get a lot of support from the suburbs on the weekend. You know, I think people who are fans of the restaurants in Detroit and who visit them still try to support as much as they can. It's definitely not as much as during the summer, but that's what happens in the winter. People want to stay at home and you know, nest a little bit, I guess. Yeah, we get a lot of support from the local community, the Corktown community, but it is different. Detroit has a ways to go before it is more neighborhood type spots. You know, those certainly exist, but not all the restaurants can maintain that way. So it's definitely highlighted some things in Detroit that need to sort of change and evolve to make businesses, you know, the small businesses in the area survive a little bit better in the event something like this happens in the future, you know.
Have you been able to take advantage of some of the programs that have been out for the restaurant workers and the small restaurants such as yours as well?
Yeah, for sure. I mean, we've been awarded several grants, which have been great. You know, the Free Press put together a couple cool little programs where we get paid to feed hospital workers and people in need. So there's been 2 rounds of that, which has been nice. Little shot in the arm, you know. During this, has been any way we can try and secure revenue and get creative. We sort of explored, and so it's been fun and interesting in that way, but it also gets a little tiring when it's like you're constantly having to pivot. You know, sometimes it's like, can we just, you know, stick to one thing for a little while, you know?
It was like, it was okay once, twice.
Yeah, just for a little while, you know, like, so.
Well,
the light is at the end of the tunnel. I'm taking all my staff today. We're all getting vaccinated today, so.
Yeah, because the city of Detroit has added restaurant workers to their list of essential workers, which really I think is going to help, because I think about the city of Detroit and their budget and what this is going to mean for their bottom line. And so they need restaurants to reopen. They need the taxes. With that too, tell us more about your pop-up. When is it going to be and where?
The pop-up in Ann Arbor is February 10th and 11th. It's at Cirque Bar. It's carry out and delivery. It's already sold out, so if people want it, but we're going to do another one next month, and we will release information on that probably in a couple weeks. And we send out a link, or we post a link, and people pre-order. But the Ann Arbor one sells out pretty quick. I think the last one sold out in about 6 hours. So,
that has to make you feel good, at least.
No, it does. It's like the balance for like, oh, we only had 10 orders tonight. Okay, well, at least we have this. So like I said, it's a lot of pivoting to like, what's gonna work this week,
So Brad, I know that as you guys start to reopen at the end of the month, it's reservations. So what's your website for people to be able to get more information, but also to look at your amazing menu?
You can just go to takoydetroit.com, and that will, from there, you can access all the different things that we're doing right now. So you can book reservations for when we open at the end of the month. You can order carry out from there. You can subscribe to one of our different monthly subscriptions. We have a wine of the month, cocktail of the month club, and then we have the cookbook experience, which is like a meal kit of three dishes. You get the recipes and everything, and it's delivered right to your door. So,
how much do you think this is going to set back the restaurant scene in the city of Detroit? Because Detroit was getting so much love for the restaurant scene, not only locally, but nationally.
Oh yeah, everywhere. I think it set it back a little bit, but everywhere is set back. So it's not like we're falling behind because everyone else is getting ahead or something like that. It's everyone is going through the same thing all across the country and to a certain degree all across the world. So everyone is in the same boat, and what I like to say is it just feels like we're on like an extended pause. So but the thing is, during this time it's allowed all the chefs to get creative in different kind of ways, and we're not putting food on plates, we're putting them in boxes and in kits, and I don't want to say it's been a great change, but new perspective on everything is always good, I think. So as long as we can get back to a little bit of normalcy here in the next year, I think it'll have been a good learning experience.
Have you ever thought about bringing back the food truck?
I still have it. It's in disrepair, but we've thought about making it part of incorporating it a little bit into the restaurant, and having it as like a walk-up where people can get ice cream or like simple food. So we'll see. That's definitely, I won't step foot on it again, but the people romanticize food trucks, and the people who like stick with it and like kill it, I have so much respect for. It was just, it wasn't the right thing for me,
Right. It's like you said, when it's simpler food.
Yeah, and from day one when I had that thing, I was trying to run a restaurant out of a truck, and it's like when you have the truck, you need to focus on one thing and not try and be a creative, chef-driven restaurant operating out of a truck. So, yeah, so if we bring it back, it's going to be like you can walk up and you can get a soft serve. We have coconut milk ice cream. It's very popular, so we might do like a little soft serve version of that, or maybe one food item, not a 10-item menu from scratch.
See, Brett, that's the universe's way of telling you, don't be so fancy with your food.
No, for sure, and part of the thing that we've had a lot of fun with at the restaurant myself and my cooks is, we've, because it's a pandemic, we're like, whatever, we'll just make whatever we want, So if you had asked me, 2 or 3 years ago, if we'd ever like offer a burger at Takoy, I would have been like, no, but we did it, So we've had some fun, like just playing around with, sort of simple classics and making sandwiches and nachos and other stuff like that like you would never normally expect at the restaurant. But during this time, I think people want a little bit of what's familiar and what's comfortable to them. So,
you know what? It seemed like a few years ago, the pop-ups were all the rage.
Yeah.
Especially in Detroit. And I know we had some really good ones in Pontiac as well. Is that still happening? I mean,
yeah, they're actually, the pop-up scene, it kind of was a little quiet for a while, but that's real big right now. There's 4 or 5, 6 different ones in Detroit, and then there's a lot also in Ann Arbor, so I think, and they're getting a lot of support just because there's a lot of unemployed cooks right now, so they're looking for something to do, and so let's try a pop-up. There's a lot of empty kitchen space right now, so there's places to be utilized. So yeah, multiple things are feeding into that coming back, and then people wanting to try new things because some new restaurants are opening, but it's obviously slowed down. I think we're not going to see the growth in restaurants like we were seeing.
Yeah, I think was that one? There's been more than 3,000 restaurants that have closed in the state of Michigan throughout this pandemic.
Yeah, it's crazy, and I think more will continue to close probably. Especially it's hard. We have Takoy has an advantage because we've been around for 5 years, and we've built a name, and so it makes it a little easier for us to weather the storm. Whereas, our other restaurant had opened just 4 months before the pandemic started, and never even really got off the ground. So we decided just to focus on the one, and maybe sometime in the future we'll try and expand and grow again.
With that, just one last question here with you too. When it comes to employees, do you think it's going to be more of a challenge to get back some of the very talented people, because you're not a neighborhood dive bar?
Right, right.
Your employees need certain skills, or do you think there's so many people out of work that they're going to want to come back, or have some people left the industry altogether?
I mean, there's definitely been some people that have left the industry altogether. We're going to have challenges for sure. And the thing is, we were having challenges before the pandemic, and I think it's going to force the industry to look more at how restaurants treat employees and how guests treat restaurant workers, to be honest. Because the thing is, people want good food, and they want preferably local and organic food, but then they want all of that cheap, and those 3 things can't work if you also want to pay decent wages to your staff, so creating a more equitable like restaurant work environment has been like something I've been into for quite some time. So it's going pretty well right now, and we'll see. I think people will come back to the industry, because as long as there's love for food and people wanting to learn to cook stuff, it's a great place, especially for young people in their 20s, 30s, to earn some money.
And people too, I think they just miss that energy of going out to eat. So it's like you said, at least the pandemic maybe has highlighted some of the issues within the restaurant industry that can be fixed coming out of this. I will say one thing about the public: people are tired of cooking at home.
Yes.
They're going to appreciate people such as yourself, because your food is not just food. It really is something to be savored and to be enjoyed, because it is creativity.
Yeah, for sure. And I think if groups of restaurant owners or chefs, they get together and we talk about ways we can change it, and multiple restaurants buy into it. We have an opportunity right now to sort of switch some of the expectations because people have been out of restaurants. People are more aware that restaurants are struggling, that we can sort of change some things. You know, it'll take some getting used to, but that's what we've had to do for the last year, you know, guests and restaurant owners alike.
Well, Brad Greenhill with us here on the Megacast. I know it's been a tough year, but we're hoping that things do get better.
They will. The light is at the end of the tunnel, I think.
Most definitely. Well, good luck, and good luck with the pop-up, and we'll look for the reopening at the end of February.
Awesome. Thank you. Nice talking with you.
You too. We're going to take a quick break here on the Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/contain-COVID.
About 20 minutes left here on the Friday edition of the Megacast. I will say, man, those 2 hours flies by like that, Tyler.
Yeah, it really does. Every single day, it's a little bit of a surprise when we get to the end of the show, especially even on days when things go a little bit slower or a little bit mixed up like we've kind of had today with our scheduling. Things just seem to still fly by.
Well, we are lucky to round out the week with our next guest, Curtis Sullivan. He's the owner and operator of Vault of Midnight. Great to have you with us, Curtis.
Hey, thanks for having me, you guys.
How are things going in the comic book industry right now? Sales up, down, or pretty much where they used to be?
Well, for us, we had a challenging year in 2020. I will say we have 3 locations in Michigan, and we experienced our first ever down year in the history of our company. Our 25th anniversary is this year in July, and so it was a really, really tough year for us.
How has it been 25 years?
Good question. Yeah, I ask myself that all the time. Yeah, we opened in July of '96, and we're somehow still kicking. And as tough as the year was, we were able to make it through without letting in the single employee go. Even with being closed down for a few months, we were able to keep everybody on payroll and keep everyone paid and keep benefits alive even through the shutdown. So it was an extremely tough year financially for us, but the positive note is we made it through. We're on the other side, and we were able to retain our crew of really exceptional people. So that means a lot.
That is awesome, because I will say, when it comes to comic books, you really need to know the comic book industry, because there are so many different storylines and people are very specific about what they want.
For sure. Yeah, we really pride ourselves on that too. We want to help folks who know a lot about comics, but then every day we get curious people who don't know much at all. Maybe they've seen movies or shows, and so we really want to be able to guide new folks in too. So having that knowledge base is critical, to what we do as a retailer. So with
that, Curtis, too, how much does the movie industry impact your sales there directly? Because we've seen some of these big blockbusters be put on hold this year.
Sure. Yeah, it definitely has an impact. Some more than others, obviously, but yeah, a big successful comic book movie just gets everybody excited and gets them coming through the door. So yeah, we've absolutely noticed big events in the comic book industry kind of pivot around some key movie releases every year, and obviously all of those were canceled in 2020. So like Free Comic Book Day being like kind of the big one, the most notable one. Marvel always releases a big movie, the weekend of Free Comic Book Day. So for sure, yeah, that has changed our business big time. Having said that, big releases on Netflix that are comic book based have still been really key and drove people through the door too in a different way. So yeah, so that's been there.
Yeah, Netflix and some of the other streaming services, that really kind of I think is going to be the future. But they've had so many of these comic book related storylines that have been put out there. So is when that happens and it starts to become popular, because we've all been binging Netflix during this time, does it drive people to come into the story to get the graphic novels or even to try to learn more about the back history of some of these stories?
Oh yeah. Recent examples of that are The Mandalorian has just been like unbelievably huge on Disney Plus, right? And that the Star Wars fever is at like an all-time high. Like, you know, it ebbs and flows with Star Wars as there's content, you know, released movies and whatnot. But yeah, The Mandalorian has sent Star Wars stratospheric for us in comic books, graphic novels, board games, related Star Wars stuff. So that's been giant. And then WandaVision is the new one that people are really loving and coming in the store to check out more, find out more about those characters.
I will say, going back to Star Wars, I'm like, how many more times can they remake that movie, right?
Yeah. No, Mandalorian's been a blast. I mean, I got to say, as a lifelong Star Wars fan, you know, I'm pretty old, so I've been around for all of it, and I'm as excited as I've ever been, you know, for Star Wars with the stuff they've been doing recently. So, yeah. Good question. I don't know. Forever, probably. Yeah.
Right. But it brings generations together, right? Because you probably started when you were a kid, and now, like, you know, you can bring your kids into the genre as well and share that backstory to then get them hooked on the earlier versions as well.
Oh, for sure. Yeah, I think generational fandom is so cool. It's one of our joys as being a retailer when we see that in the store. You know, families coming in together and enjoying these things together. Like, that's super, super cool. Yeah.
Curtis Sullivan with us here on the Megacast. He's the owner and operator of Vault of Midnight. With that, you guys also have your 28 Days of Black comics. Tell us about that.
Yeah, so that is a big promotion we're doing every February. We celebrate Black History Month at our stores. We do a big display in the store. We feature Black creators, Black characters, and really just kind of highlight those stories, those comics in our shops. And this year, an awesome, talented individual at our Detroit location cooked up this big promotion, the 28 Days of Black Comics promotion, which we're doing on our web store. We're doing it in store. We're offering discounts on a featured book every single day. So 28 different selections for the whole month. We're gonna just celebrate it. We do it every year, but we're going even bigger and bolder this year. And the list of books is absolutely incredible. So stop by your local Vault of Midnight or go to vaultofmidnight.shop to check out the full list of titles being featured. Super exciting, awesome stuff.
I think it's great that you're doing that. Last week we had Kenneth Quattro with us. He wrote The Invisible Men, which was highlighting some of the Black comic book artists through the years. And it's so important to keep these stories alive and talk about, what some of these, different artists go through and how they've been able to help shape some of these stories.
Exactly. And been really instrumental in really key voices in the comic book business for, decades. Yeah, absolutely.
So for those that have maybe never been in your store, what will they find if they walk in? What sets you apart from some of the other comic book stores?
Yeah, I think first and foremost, it's the folks that work in the store. So if you walk into a Vault of Midnight, you're going to be greeted by somebody who's really enthusiastic and excited to see you. and knows a lot about comics and is passionate about, comics and graphic novels and board games and stuff. So I think that's the number one thing for us. But, probably close behind is selection and the style of the stores. We try to offer clean, organized spots where we really showcase all this cool stuff that we sell. So we should have what you're looking for in the store, and hopefully it'll be presented in like a really exciting, kind of visually appealing way as well. So, yeah.
What are your locations? I've been to the downtown Detroit store, but what are your other locations?
Yeah, so we were founded in 1996 in Ann Arbor, Michigan, and that's our first location. So on Main Street, Ann Arbor, and then we have a location that will be 8 years old this year that is in Grand Rapids, right downtown Grand Rapids, Michigan, on Monroe Center, right next to the art museum, right downtown.
So Curtis, we've seen so many bookstores, just regular bookstores, close over the past decade. Does that impact your business at all because you are still open?
Not directly, but that's sort of our model. We model ourselves more like a local bookstore than I guess maybe a traditional comic book store. Like we feature a lot of new product. We do have vintage comics and that kind of stuff, but we want to be a community hub. We want to have perennial items that reach a really broad audience, age-wise, demographically speaking. So we're really looking to the local bookstore as kind of like our template for what we try to do. So we don't see a direct kind of uptick in business, I guess, because maybe another bookstore may be shut down, because we do offer different stuff. But we hope, we want more bookstores to be around. I think that's complementary and benefits us as well. So yeah, I wasn't aware of that. That smaller bookstores have been shutting down. So that's a shame to hear. We need them.
Most definitely. And with that, because we've seen so many books are going online and digital. Is that happening in your industry at all?
I mean, it is, so when digital comics came out, probably a decade ago, they were really on this very skyward trajectory, and that's really leveled off. So the growth of print, comic books, and graphic novels and digital are pretty neck and neck. So print and digital are kind of growing at the same time. So no, I think they help more than they hurt. And I think they'll always, I hope, we'll see. I hope there'll always be a place for physical places to buy books and physical books, whether it's, prose or comics and graphic novels. So not so far. It's something we always keep our eyes on, obviously, because, in a world increasingly moving to delivery and digital, obviously that's a risk. But like I said, so far, we've never had a down year as a company, in 25 years, except for 2020. That's the only year we haven't seen year-on-year growth. So we hope that's anomalous and COVID related more than anything else, right?
Exactly. So, and the fact that you were able to keep your employees on staff is amazing. And it says a lot about you and your team as well to be able to do so. With the collectible world, is that up or down right now? Because comics are a commodity. They can be an investment.
Sure. Yeah. I think, we've had some encouraging news. Our holiday season was better than we hoped. And by that, I mean, not as bad as we predicted. So that was positive. January was flat. That's incredible. That's actually a good news. So yeah, I think stuff's holding tough. We are limited to how many folks we can have in the store. We are really, really strict with the safety precautions, right? We have a max amount of folks we let in the store at any one time. So that has had a negative impact, right? Normally we'll have, a full store of folks, and now we, in our Detroit location, we can only have 8 people in the store at a time. So that has impacted sales. But board games for us, if I had to pick one thing, long story long, if I had to pick one thing that's really, really kind of shining and has continued to outperform is board games. So that's a big part of what we do. It's like a third of what we do, and they continue to kick butt. So,
yeah. Well, and people are having more game nights, right?
They sure are. Yeah, folks are in their COVID bubble, and they're looking for stuff to do. They've watched all the shows. Yeah, board games have been on a real tear for probably more than a decade, and COVID, I think, is really, at least for us in our business, has accelerated people's interest in sitting around the table and interfacing in a different way, in I don't want to say old fashioned way, but almost, yeah.
It really is. I was going to say, I feel like old school.
Yeah.
But that's what we used to do. That's what we grew up on, right? Board games.
Yeah. Stuff made out of cardboards, no electronics, no batteries, no internet. Yeah, exactly.
With that, Curtis Sullivan with us here on the MegaCast. He's the owner and operator for Vault of Midnight. You guys are celebrating your 25 years in business and operation. I have to tell you, my husband is a comic book collector, and it drives me crazy.
It's the best. Encourage him. Love him and love his hobby. It's such an amazing hobby. I've been doing it since I was a very tiny child, and I just love it to death. I love reading comics, but I also love collecting them and organizing them and keeping them in good shape. And because they're really memories. And that's the thing that, like, I think anybody who collects anything really, I mean, you love the thing, you love the object, but you remember where you got it. You remember when you got it. If it was a special event with other friends, like we'll go to comic conventions and buy books. So it's just memories, So I encourage people to read comics, but also collect comics, So yeah, it's a great thing.
But see, here's the difference, Curtis. You have a store.
Yeah.
These are taking over our house.
Well, if he needs help organizing, we're here for him and you. We sell organizing supplies. You want to keep your collection nice and crispy, and don't let it take over your whole house. Have a designated comic area. That's my advice.
Yes, I told him he's growing out of one of the bedrooms. I'm like, no. Like, I'll walk into a room. I'm like, okay, this is your area. And I'll walk in and he'll have, like, in the bathroom, he'll switch out my cute print and put up a comic something. I'm like, no, that goes in the bedroom.
Well, you'll hear no support from me. I say, hang more comic book art. That's I endorse that.
Yeah, original artwork is really hard to get right now.
Oh, it's just amazing. I mean, it's just truly the coolest thing. I mean, it's one of a kind. I only have one piece of original art in my whole collection, but it's totally cherished. It's from one of my favorite artists and a very influential comic for me personally. So, oh my gosh, I love it. It's like having an original painting. I mean, it's just unbelievable. Yeah.
And you just think back to the day where they probably threw out so much because it wasn't considered valuable, or they were, paper was being recycled back during the war. And it's like, wow, to have all that. And it's history, like you said. But Curtis, it's been great having you again. What are your hours too? Do you guys have reduced hours? Do you want to share any of that information?
Oh yeah, that'd be great. So yeah, folks can interact with us. All our stores are open, but we do have reduced hours. We're 11 to 8 every day, which I know doesn't sound that reduced. We were previously 10 to 10, so we're just always open, but we're open 7 days a week. We offer at-risk hours on Thursdays from 11 to 1 for at-risk guests every Thursday at every Vault of Midnight. And you can also interact with us through our web store, vaultofmidnight.shop. We offer curbside pickup. We offer mail order. So yeah, and you can call us or email us too at any one of our shops and just ask us for recommendations. We're happy to pick something out for you, mail it to you, get it all set up so you can just pull up and pick it up contact free. So yeah.
I will say it's almost Valentine's Day, for the comic book lover in your life. You can always get them a gift from your store, right?
Yeah, and we do, like I said, we do board games and Dungeons and Dragons and dice and cute plushies, so, we little figurines. So yeah, we like to think we have something for everybody, even if they might not know it until they walk through the door. So yeah, definitely come get your Valentine's gifts at Vault of Midnight for sure.
I will say, they know me well of the comic book store close to our house because I'm always like, hey, what does he want? And they always tell me. So it's great to know your staff as well. So Curtis, it's been great talking to you.
You too. Thank you very, very much for taking the time to, let me get on and talk about comic books in Vault of Midnight.
Absolutely. And again, we wish you the best of luck in 2021. And let's hope that we are on our way out of the pandemic and we can get back to life and as we used to know it and success for your business.
For sure. Yeah, we're really excited. We're upbeat for 2021. We got some really big announcements coming in the next few months. So, yeah, we're excited. We're feeling upbeat about 2021.
Well, good. And anytime you have anything you want to share, please, you're always welcome back on the show.
Dig it. Awesome. Thank you so much.
Curtis Sullivan with us. He's the owner and operator of Vault of Midnight. And that is pretty much going to do it for this week on the show. Tyler, any big plans that you have for the weekend?
No big plans for me this weekend, but some programming notes for us. We a couple days ago went to West Bloomfield High School for their second National Signing Day and recorded 8 more athletes signing their national letters of intent. That will be premiering over the weekend on Civic Center TV and on WBTV, and will be posted to our website later today.
Great. And we also want to let everyone know, get out, enjoy the weather. If you build a snowman, put a picture up on Instagram, #SnowTheLove, so you can help the Rainbow Connection. Great organization. That's going to wrap it up for the Oakland County Megacast.